$30,000.
$50,000? That is insane. How do you even begin to pay that down? You have more debt than the average American does annual income. That's crazy. Welcome to America, where we have more expensive healthcare than anyone else, worse outcomes than a lot of other places, and about $220 billion of medical debt. And with the government subsidies being removed from the Affordable Care Act, it's actually going to get more expensive to pay for health insurance. My hospital bill, 1.8 million? That is an incomprehensible number. I mean, at that point, you just file for bankruptcy. There is literally nothing to do here. There's no way that you're ever going to be able to pay that back. If you were to pay $5,000 every month, which is more than most people make, it would still take you 360 months to pay this off. 360 divided by 12 months in a year, you're going to be paying this off for 30. This is like the length of time for a mortgage if you put every dollar you earned to it. Now, I did notice that she's covering the total charge. There's the total charge, so that's everything it was. But then like the adjustments and the amount that the insurance paid is covered. So probably she doesn't have to pay for all of that. Because like surely the hospital is not going to expect her to pay $1.8 million, right? Like they know that people can't afford that and they're not going to get their money. It seems like it'd be better for them to like give a discount and be like, all right, we'll just take what we can get.
I just got my hospital pill. I am 9 weeks postpartum.
Congratulations.
And I thought I would just share with you all what I'm paying for and how much I'm paying to have a baby in the United States.
Okay, how much to have a baby in the United States? I saw a post somewhere where someone said it cost them about $30,000, so I'm going to assume she's somewhere in that $30,000 range. We'll see.
So let's just walk through here. Room and nursing service. $7,400.
Room and nursing service is $7,428. That's just the room and nursing. There's no actual procedure or medical care being covered there. Like the actual procedure part of the hospital visit and giving birth has not even happened yet, and you're $7,500 in the hole. That is unbelievable. But I bet it gets so much worse.
$28. Supplies.
The most generic supplies, whatever that means.
Anesthesia.
And you know they bill it under supplies so that they can just make up whatever the number they want. Like what do supplies even mean? Like, oh, medical gloves. Like how are you going to prove they use $339 worth of medical gloves or like needles or something?
I believe this is my epidural. $5,442.
One shot? Your epidural costs $5,442? And again, we haven't even gotten to the delivery part, which I assume is going to be the most expensive. All we have is someone sitting in a hospital bed in a room with at least one nurse being there as well and getting a shot. That's it. And we're at almost $13,000. And again, the actual reason she's at the hospital hasn't happened yet, and she's like 15 grand in the hole. Oh, here's the juicy part.
My baby? My baby?
Yeah.
$17,852.
$17,852? I feel like I wasn't even close. I had said 30,000, but I think we're actually over 30,000 at this point. I think we're in like the 32,000 range. I think there was a comment down here that was like $17,000 for you to push the baby out. Yeah, the doctor's just kind of a glorified catcher here, aren't they? He didn't really do anything. She did all the work, and yet she has to pay $17,000 for her doing all the work. That is crazy.
Laboratory. $2,045.
You know, the lab fee is really important because that's where they cook up all of these medical prices that they're charging you. It's also so generic. What does laboratory even mean? It could be anything.
Respiratory therapy.
Respiratory therapy?
I genuinely don't know what that
Maybe for the baby?
But apparently I owe $356 for it.
That's probably just the nurse telling her to breathe, and she's like, oh, respiratory therapy, better charge her, $350 an hour for it.
Treatment room. Tell me
Treatment
how that's
room.
different than anything else. $3,982.
The treatment room is $3,982. How is that different? They already charged her for room and nursing, but like, is the treatment room not a room? Room was already in the bill for $7,500, and then they're like, oh, but also treatment room is different, so another $4,000 for that. So it's $11,000 of rooms that are in two different bills, even though the first one said room. What the heck, hospitals?
And then pharmacy.
Oh, good,
So,
pharmacy.
Ibuprofen.
Yeah, just like
Tylenol,
over-the-counter stuff, Tylenol. Yeah.
$4,387.49.
Hospitals do this all the time where they'll charge you like $100 per ibuprofen pill, even though it's the exact same thing that you could go and get at Walmart, like a whole bottle of them for $10. But because you can't go to Walmart because you're stuck in the hospital with an emergency, presumably, or like you're giving birth to a child, so you can't run out and get ibuprofen, they charge you as much as they want because, like, what are you going to do about it?
Most expensive ibuprofen I've ever heard of.
All right.
For a grand total.
Grand total of $41,831.49. It cost her 42 grand to give birth in the United States. That is unbelievable. And not only is that unbelievable, but I saw this other person in the comment was down here that said that I just got my gallbladder out. The 3-night, 4-day stay. Didn't even use all of the meds I had available to me. Less than a 2-hour, somewhat simple surgery. $135,000. But then, sorry, I misspoke. Actually, $139,000. They put like an entire mortgage for a house on their gallbladder surgery. Also, if you like this video, feel free to subscribe. I post almost every day. Now, when you see things like this, it's kind of not a surprise to learn that medical debt in the United States is rising pretty significantly. Thirdway.org, which helps track some of these things, talks about this here. The average debt for medical care is increasing. The average amount of debt people owe for medical care has risen over the past 5 years. In 2017, the average medical debt was $12,430, which is a huge amount, by the way. Most people are not able to pay for an extra $12,000 surgery that they weren't expecting to. In 2021, so more recently, it was $18,660, a 50% increase. Higher debt amounts per household have coincided with a decline in the number of people with medical debt, as many delayed medical care during the pandemic. They couldn't afford it. They didn't have jobs. Everyone lost their jobs in the pandemic, and the whole country shut down. Nobody had money coming in, so they couldn't go to the hospital. That change also reflects a general decline in households holding any kind of debt from 76.5% to 73%. Families reduced their debt using COVID stimulus checks by spending less. Because of course medical debt is going up. Who can afford this? Sure, a lot of people have insurance, but insurance has copays, and that doesn't even cover everything. You know that if you go to the hospital and you pay your copay, your insurance doesn't cover stuff. Because like if you have a procedure, then someone inside of the procedure that helps you out might not be in network, even if the hospital and the doctor are. A few years ago, I had an ER visit, nothing major, but I ended up getting a saline drip and blood work. That was it. That was all I got. And I had insurance. $2,000 medical bill. And so many people just kind of accept that this is the way that it is or the way that it has to be. It's just the cost of living in the United States.
I just had a
But it kind of doesn't have to be like that. Listen to this.
medical emergency in Japan, had to go to the doctor, and here is everything they did and how much I paid compared to how much I would have paid in the US.
So she was in Japan. She has no medical insurance because she's a United States citizen, and then had to go to the ER in Japan. And she wants to tell us exactly how much it cost her to do that.
So then, because I had no insurance, like no Japanese insurance,
has
they
no
gave me the itemized receipt immediately, didn't have to ask for it up front before I paid. Then they gave me an itemized receipt translated to English so that I could take this to my American healthcare provider and see if they can cover it. That made me think, oh God, it's so expensive that they're going to want me to try to file it. Then they turned to me and said, okay, that's 4,800 yen.
Sounds like
Do you want to know how much 4,800 yen is? Mind you, that includes all the prescriptions. They give it to you while you are there. No pharmacy needed. $33 freaking dollars. Mind you,
her healthcare cost with no insurance is like 1/10 of my premium for care that I will have to pay for anyway if I go to the hospital. My insurance is basically just a glorified coupon, or allows me to step into this glorified club where I'm able to go to a certain hospital and not go absolutely bankrupt, but I still have to pay money.
I just went to Walgreens to get my updated COVID vaccine because I need that before starting med school. And I was having an insurance issue because, you know, I don't have any employer-based insurance since I don't have a job right now.
She's a student,
but I have my meeting with Medicaid sometime this week. And I had quite a bit of money saved in my health savings account through, you know, working in a time healthcare job for 2 years. So I was like, I'll just do self-pay. Tell me why it was going to cost $300 without insurance to get a COVID vaccine and a Hep B vaccine. 2 vaccines. $300.
$300 for vaccines is crazy, especially since the cost to produce them is like a few bucks. Oh, and also, the US government subsidized the creation of those vaccines. How much did the government spend to promote the development of COVID-19 vaccines? Estimates of direct public spending on the development and manufacturing of COVID-19 vaccines vary considerably based on the range of sources examined and the timing of data collection. Recent estimates from the Congressional Research Service and the Government Accountability Office and Chad Brown and Thomas somebody, along with data from the GHIAA.org and DevEx websites, provide the government spending estimates of between $18 billion and $23 billion. Most recently, the Congressional Budget Office has estimated that the Biomechanical Research and Development Authority, the BARDA, I guess, alone spent $19.3 billion on COVID-19 vaccine development. In addition, Lisa Cornish projected $39.5 billion in U.S. spending. These funds, which have attenuated industry risk in developing COVID-19 vaccines, are on the top of years of government-funded vaccine research that set the platforms for the current successes. So she's paying for a vaccine that the government funded research for. And where do you think the government got the money to fund the research? from taxes that she presumably has paid into. So she had to pay $300 for vaccines that she had already paid to help develop. And what's even worse about this whole situation is it's probably going to get worse. Cost of Obamacare expected to soar as subsidies expire and insurers hike premium rates. People with health insurance through the Affordable Care Act could soon see their monthly premiums sharply increase as subsidies expired and insurers propose major premium hikes for 2026. Insurers that offer plans through the Affordable Care Act are planning an average premium increase of 15% for 2026, the largest increase in 7 years, according to an analysis published on Friday from the KFF, a health policy research group. The analysis is based on filings from more than 100 insurers in 19 states and Washington, D.C. The increase will likely come on top of the loss of enhanced subsidies that helped people pay for ACA healthcare plans by capping the costs at a certain portion of their income. I understand there's the whole fraud, waste, abuse argument, but it's crazy to me that we're going after low-income people who are just barely on the margins, who may or may not actually qualify, and maybe they can work and maybe they can't work. We don't really know. And we're not going after the insurance companies that are raking in billions of dollars off of these premiums. We've chosen to go after the poor people instead. It seems like our anger is directed at the wrong people. They are raking in insane amounts of money in insurance premiums. Just look at this. This is her talking about how much she's paid in insurance premiums.
So that line right there that's highlighted, FEHB, Federal Employee Health Benefit, per paycheck, I pay $187 and change. So the year-to-date amount that I paid personally was $4,870 and chanch. So the government pays 75% of the premium. So per paycheck,
so she's paid
the
almost
government is paying $561.98, and per year, they're paying $14,611.
$14,000. So she's paying $5,000. The government's paying $14,000. Basically, it is $20,000 in insurance premiums that she's just giving to the insurance healthcare company. And that's before she pays for anything else. Just to be a part of the program and have access to their in-network hospitals and the discounts that they give is $20,000 per year. And this is before any medical coverage. You know that she's going to have to pay for that when she goes in. For doing absolutely nothing, her healthcare provider has made $20 grand. It's essentially pure profit. And the Affordable Care Act doesn't even just cover low-income people. You can see here that it covers a lot of other people, individuals and families who do not have access to affordable health care insurance through their employer or government program like Medicare or Medicaid can enroll in the Affordable Care Act health insurance plans through the health insurance marketplace. Eligibility is not based on income alone, but also includes residency, citizenship status, and other factors. So yes, it does cover people that are low income, but it also covers people that run small businesses and are self-employed. Low-income people who already have it hard are going to have it even harder, and small businesses who already, one, operate on a pretty thin margin, but two, really can't afford any more cost increases, what with the tariffs and everything, are going to also have it even harder. This affects a lot more people than just those who are abusing the system. There is a lot of everyday people that this is going to severely impact. ACA enrollment reached a record high last year, totaling more than 24 million people, according to the Centers for Medical and Medicaid Services. Much of that growth was from extended subsidies, the agency said, with the average monthly premium was $113 compared with $162 in 2020. According to the KFF's latest analysis, most ACA insurers are proposing premium increases of 10 to 20% for 2026. More than a quarter, the group said, are proposing premium increases of 20% or more. What people actually end up paying out of pocket for their monthly premiums could increase on average by more than 75%. Larry Levitt, the executive vice president for health policy at KFF, said on a call with reporters last week, a family of three earning $110,000 a year and enrolled in a silver ACA plan, which usually comes with modern monthly premiums, could see their monthly cost jump from $779 this year to $1,446 in 2026 when the enhanced subsidies expire, according to KFF. If insurers raise premiums by 15%, the monthly bill could climb even higher to $1,662. 24 million people, many of whom presumably can't afford higher premiums, are going to be forced to pay between 10 and 20% more because their only other option is to go off insurance, go into medical debt, and have their entire financial lives ruined. This is going to hurt a lot of just normal people.
He wouldn't survive, I'm afraid.
Do you have Medicaid right now?
Yes, I do.
Yes.
Yes. Yeah.
Yes, I was just approved a few weeks ago.
You know, there's this narrative that a lot of people on Medicaid are lazy. Do you feel that's accurate?
No, absolutely not.
No, I'm not lazy. I try to get a hustle as much as I can.
No.
I mean, they might be, but like to presume that they are on Medicaid because they are lazy is just not correct.
No, I think they just can't help themselves.
Well, no, because I work. I do mechanic work, and so it
Mechanics hard.
kind of fluctuates. I have a bunch of health problems. I can work, but eventually I'll be where I can't work.
Just got laid off.
I'm a hairstylist, so it really just depends on how much I bring in due to my clientele.
And a lot of the hairstyling, you can imagine if people don't have very much disposable income, they're not going to get their hair done as much. Doing your hair is very much a luxury.
Currently trying to get like a part-time job, like a night job, just to put more money on the table, especially with the economy going up in prices and stuff.
That's also a good point. The price of everything has increased tremendously in the last 3 or 4 years. And so to have yet another thing increase by between 10 and 20%, presumably when you're already struggling on the margins because everything else is so expensive, that's just kind of brutal.
Can you tell me about how it would affect you if you lost your Medicaid coverage?
Oh, Lord, I would have absolutely, teetotally nothing. I would not be able to live, period. I wouldn't even be able to eat.
It would affect me real bad because I can't support myself.
It'd be a very big impact because that's all we got right now.
I have some
This is like hope for some
possibly
people.
terminal illnesses, and I've had to postpone it waiting for Medicaid. And I'm sitting here
Postponed care is awful.
literally just trying to survive.
These are the people that are being so heavily impacted by America's broken healthcare system. People who have low incomes, mental disabilities, physical disabilities, or for some reason are unable to work as productively as me or a lot of the people viewing this video. And they can't afford to have their own insurance, and they don't have employers that are paying for insurance for them. And for these people, things are about to get a lot worse. Thanks for watching.